Hello everyone, so these videos are a little bit delayed. Winter's there picking at the tripod stand. That's Max there if you can see him. I'm in the dog's room. But yeah, it's been a while since we've done one of these videos. I had said in the previous video I'd like to do them weekly, but so much has been happening lately. If you missed the other video, there's Winter there now. If you missed yesterday's video, I did mention about the things that were going on the past few weeks. Just very briefly, just discussing what was going on. We had our eldest dog, who was 14 years old. He ended up passing away. Then shortly after, a few weeks after that, Ryan's grandfather ended up passing away, and then I have just been extremely sick during this pregnancy. Now this is going to be for the 9 to 12 weeks of the first trimester and how that all went. I'm in the second trimester here now, which is, oh my goodness, so amazing. We have miscarried 5 times previously, and all of them ended up being prior to 12 weeks. The longest we were ever pregnant before was at the 12-week mark. Before that, it was usually like 6 weeks, 4 weeks, things like that. The longest ever prior to this point in time, it was 12 weeks. So we were just, oh my goodness, overjoyed, so excited, so happy, so thrilled just to be past the first trimester and past 12 weeks. So anyway, like I said, this is a recap of the 9 to 12 weeks, signs and symptoms I've had, and during that time between 9 and 12 weeks, it was pretty much all the same for those weeks. Now I ended up at 8 weeks, as I mentioned in the other video. That was my best week, and even to this day, that was my best week of just feeling so like relieved, not feeling too many symptoms, not feeling really sick. It was just nice. Oh, there's Claire Bear. But oh my goodness, as soon as 9 weeks kicked in, I was back the other way again. Extreme food aversions ended up starting. I ended up getting very, very sick again, turning away all types of food except popsicles. Popsicles were the only thing I found that I could actually keep down and not get sick. I had to be very careful, and when having meals, they were very small in size just because I knew I was very queasy. I was still, sorry this is TMI, but I was still throwing up. That, even to this day, has been just consistent. I've just been very, very sick through this entire pregnancy. During the 9 to 12 week mark, I also ended up having headaches. Now, they weren't all the time and every day. They were just, They were just sporadic here and there. I'd have one day, the next day I wouldn't, then the following day I'd have another one. And it wasn't for like long periods of time. They were just short little headaches. I did start to dream in like weird out to lunch dreams. Like, I mean, woohoo, they were, I don't know, they were very, very interesting dreams. So that was happening. I didn't have a lot, but I did have a few during the 9 to 12 week mark of dreaming. I had mild back pain. It was nothing over the top. I did though start to notice some back pain occurring during that time, and tired. I did become tired once again. It wasn't as bad as the first few weeks, but I ended up becoming once again quite tired in the mornings and sometimes in the evenings. But I noticed as the weeks went on and I got closer to the 11 to 12 week mark, I was starting to stay up a lot more in the night times, and I was going to the bathroom a lot more. But that's pretty much my signs and symptoms for the 9 to 12 week mark. Now I'm going to go into the next thing that we ended up going to, which was the ultrasound. Oh my goodness. So we ended up going out to the ultrasound, both extremely anxious. Both of us were very nervous and excited, but we were more so, like I said, anxious and nervous just because of previous times and everything else that ended up happening. And this would be the first signs and real indicators, besides us taking some pregnancy tests and besides doing the blood work and besides peeing in a cup at the doctor's office. This was pretty much, I guess, the real, oh my goodness, you are pregnant, it's still happening, everything's looking good. That's what we were looking for. I guess just some solid visual. Now the other stuff was kind of visual, yeah, I guess, but I don't know, this is just different. I wanted something just to really say, there's baby, everything's looking good, and you can take a deep breath and just, here we go. So this was at the 10-week mark, and exactly at 10 weeks, we ended up going out for the ultrasound, and I'm kind of upset, and for this reason. The ultrasound tech was kind of like not really into it, I guess, that day. I don't know if she was having a bad day. She had a rough night the night before because our appointment was extremely early. I don't know, but she was just not with it, I guess, and just didn't seem to want to be there that day. So we ended up going into where the x-ray machine was. She takes the draping, the piece that goes across your lower stomach. It's just like a little towel, just so you don't get none of the gel on your pants and stuff, the gel that they use for when checking to see the baby. And it's just to give you a little bit of privacy where you do have to roll down your pants a little bit so they can do that where it is on the very lower end of your stomach. Now, my anxiety, like I said, was extremely high because I was just so nervous and scared about, are we actually going to hear the heartbeat or see the heartbeat? And because it's little flickering, fluttering, like it's kind of hard to explain, but you kind of see the heartbeat. We can't technically hear it at this point. It was still too early to hear it, but we could physically see it on the monitor. But I was just really, like I said, anxious. My husband was also very anxious and nervous. He was sat in the chair. The ultrasound tech just took the draping, just tossed it over where I had to lie down. And I was just like, okay. So she's like, okay, lie down over there. I was like, okay. There was no real like greeting, no, is this your first experience with this? No, just, okay, you seem very uncomfortable, because you could clear as day tell that I was like very nervous. There was nothing. It was very, she's cold. I guess that's the best way to put it. She was kind of cold. Laid down and the draping was there, and I'm used to the ultrasound tech, or anytime I went in to get x-rays prior, they would usually do that. She was there just staring at me, waiting for me to do it. And I just said to her, I'm very anxious right now. I know what I need to do, but I can't process it right now because I'm just so nervous. Is it okay if you put the draping / towel where it needs to be located? It's okay by me, because I wasn't sure if she was just not comfortable with it, which was kind of odd, because even when I went in to do massage therapy, putting that there was your job. You had to put the draping, I guess the towels, blankets, whatever the case may be, where they needed to go properly. But she just looked at me and was like, it goes here, and just was like, she just pointed and was like, this is where it goes. And I was like, I know, but my anxiety is really bad. And even my husband said after, he felt really bad because he would have got up out of the chair that he was in and came over and did it for me. But he said he was so nervous and just trying to not show how nervous that he was to try and keep me relaxed, that it didn't even dawn on him to just come over and do it for me, seeming how she wasn't going to do it, seeming how nervous and anxious I was. And I just told him it's fine, like it's no big deal. I managed to do it after. And even when she was checking, it was just quiet, which I understood for the first bit. It got to be because they have to check all the stuff first to make sure everything's looking good and okay. So that I understood, and it was probably a good thing because it gave me a minute to just take deep breaths and just try to relax and everything else. The entire time there, and she was just kind of rushing and everything too. There was no communication. Even after she did that, she just flipped the screen right quick. She's like, there's the heartbeat. Do you see it? And I just looked. I was like, I didn't see it. My husband said he's seen it. But I was just like, yeah, even though I didn't see it, but I just knew she was very, like, done. She wanted us out of there, move on to the next person, done with the day. Like I said, even though it was early in the day, but she just didn't want to be there that day. Like I said, I don't know. And I didn't want to seem like I was being a burden and asking too many questions, because she clearly was in no mood. So then she flips the monitor back and she's like, everything looks good with your baby. Everything's fine. It's 10 weeks now and everything looks healthy. And that was it. I was just like, okay. Then when she went to print off the pictures, she prints off just one, which I was kind of upset about, because I honestly was hoping at least for 2, maybe 3 at the very most. I wasn't expecting like a whole reel of pictures or nothing like that, but I just wanted another one because Ryan's parents have been waiting so long for a grandchild. He's the only child on his side of the family, so this has been a moment that they have been anticipating, waiting, knowing how much we've been struggling, knowing how long we've been trying. So I wanted an extra one, so they ended up having their own copy. But she's just like, here you go, and hands us one. Didn't say anything else. She's just like, here you go, here's the picture of the baby. And away we went. I don't even think the appointment was 5 minutes. Getting in there to us getting back out to our vehicle outside the hospital, it was 5 minutes. Now we did have to wait and everything prior for a bit, yes. But I'm talking about the moment we entered the room for the ultrasound to the moment we left and got back out in our vehicle outside the hospital, we were 5 minutes. But I don't know, like I said, she was just, I hope we don't get her at the next ultrasound appointment, because I will end up requesting probably somebody else. And it's not me trying to be rude or disrespectful, it's just, she didn't make our very first experience a very memorable one or good one or happy one or anything. It was just like, I don't want to be here, but I gotta be here type situation, and you're kind of just here and it's irritating me that you're here, and I don't know. And I was just like, okay. And even my husband was just like, all right, well, I guess, you know, it is what it is. I was just delighted and happy that everything was fine with the baby. The heartbeat was there. I could just relax and take a deep breath. And I'm gonna throw up the ultrasound picture here now so you can see, and it looks like just a little glowworm. Like I said, it was only 10 weeks, so it wasn't really too much developed just yet. Still quite tiny, but yeah, there's baby. Then a few days after that, we ended up having another doctor's appointment. We had to go back because Ryan's blood work results came back. All of that was good. He had to get that done, as I had mentioned in a previous video. And I had to go in and make sure that I was gaining weight, which I was. I gained a pound from the last appointment. They just checked all my vitals to make sure all that was okay. My heart rate was good, my blood pressure was good. And then they wanted to test me and make sure that I didn't have diabetes or anything. But overall, it was an amazing, wonderful experience. Like I said, I just wish the tech was a little bit more uplifting, a little bit more seeming like she wanted to be there and wanted to do the job, not so much like she hated her job or hated being there or whatever the case may be. And like I said, maybe she was just having a bad day. It is what it is. And to me, in the grand scheme of things, that's her, whatever. I'm happy that all she said to me was, baby's okay, everything looks good, 10 weeks, heartbeat, good to go. That was enough for me, even though she didn't say nothing really else or wasn't very comforting or anything else. But I was just delighted for those few words that she did speak. And even though it was only one picture, it's okay. Like I said, it would have been great to have more than one to give family members, but at the same time, I guess we could just scan the one that we had, like my husband said, and give copies of that one to family. So we tried to look at the silver lining and just the better side of things, not focus so much on the negative. Besides being extremely sick in the first trimester, everything else is going really good with baby, so thumbs up to that. So I'm very, very happy about that, because that's what's really important with all of this. Like I said earlier, I'll do another update in 2 days for the weeks with this trimester thus far, for the second trimester. But before that, tomorrow I'm going to be doing a video just recapping the first trimester, what we picked up so far, what we are doing so far in regards to planning everything and everything else. Hi! That's Aspen. But yeah, thank you so much for watching. I'll see you in the next video. Bye, everyone.